And on today's episode, we want to look at acute bronchitis and also the evidence based in treatment of acute bronchitis. Do we need to get antibiotics for acute bronchitis in all cases? Well, let's dive into it. Now, acute bronchitis is basically the inflammation of the big tubes that goes into your lungs. You call the bronchus. When they are inflamed, they produce a lot of mucus, and also they produce, people have cough as the main symptoms of acute bronchitis. Now, besides the cough that you have and the mucus production, sometimes people may experience shortness of breath, or they may have a fever, or they may have produce sputum that is blood-tinged, or they can have sputum that is green or yellow. And that doesn't really tell you if it's bacteria or viruses, because I have patients come to me and they said, well, my sputum is yellow, is green, and so definitely I have a bacteria and I need antibiotics. But that is a myth. That is not true. Okay, so the color of the sputum does not depict if it is bacteria or virus. And people will have that. And usually when you have acute bronchitis, you may have this cough that's gone on for almost about 3 weeks. And so that is typical of acute bronchitis, instead of like upper URI, where you may have a cough for a few days and it's gone away. So that is not acute bronchitis. And sometimes also when people have acute bronchitis, they could have wheezing, especially those who have asthma or who are very sensitive airway, they could have wheezing as well as acute bronchitis. And the question becomes, do you always need antibiotics for acute bronchitis? And what are some of the causes of acute bronchitis? Now, 90% of acute bronchitis is caused by different kinds of viruses, and a few of them are caused by bacteria, or sometimes the air pollutants or the pollution in the air, the irritation of your airways can cause that. Smoking can be a cause of bronchitis. Smoking cigarette or marijuana can be that. Exposure to secondhand smoking can be a risk factor. If you have a weak immune system, that can also be a risk factor. And also people with asthma or COPD or congestive heart failure can also be prone to having acute bronchitis. Now, what do you do if you have acute bronchitis? Now, there have been several studies have been done. The American College of Chest Physicians actually are against the use of antibiotics for acute bronchitis, just because they think that 90% is caused by viruses. But there are special cases where you could be given antibiotics, right? And there have been a study that was done where they gave people who had a cough for over 3 weeks, and they gave them azithromycin. There's a whole random control trial. They give them azithromycin, and azithromycin were taken for 5 days, and on day 3 and day 7 there was no difference as compared to the placebo group on the severity of their cough and improvement of the symptoms. There's really not a really good data to give antibiotics to patients with acute bronchitis. But unfortunately, over 70% of patients who go to the doctor's office do get antibiotics for a viral acute bronchitis, and that is a big problem. It's either your doctor is not explaining it to you, not giving you the chance to explain to you why you don't need it, or they just give it to you. So again, 90% is viral. Now, some of the things that you can do when you have acute bronchitis. Number one, bronchitis can last up to 3 weeks and you get better, or sometimes up to about 6 weeks for you to get better. But there are certain things you can do, symptomatic management you can do, and let's look at the evidence and see what is working today and what is not working today. There are a group of cough medicines that are given to us when you have acute bronchitis, and the first group is called antitussives. Antitussives, these are cough medications that suppress your cough center in the central nervous system, therefore reduce the cough. And there are opiates kind of base antitussive and non-opiates, and also peripheral antitussive. And the opiates-based antitussives are codeine medications that has codeine in it. I have patients tell me, well, give me some codeine and I'll be well. But the studies that have been shown, there have been 2 studies, big studies, shows no benefit using codeine. Instead, it has a lot of side effect to it. Now, there's another non-opiates that is also antitussive called dextromethorphan. Dextromethorphan. and that has been used for suppressing the cough as well. It's non-opiates, and actually the study is in the favor of dextromethorphan. The three placebo-controlled big trials that were done, and they found out that their cough was reduced up to 36% of those taking dextromethorphan cough medicine. So you can see there is a little bit of what do you call it, benefits in taking that. Another one is benzonatate, which is a peripheral, again, a cough suppressant medication, benzonatate or Tessalon pearls. I'm sure your doctor has prescribed that to you before, but the studies that was done, there was two studies. There was a one Cochrane review and two small studies, and they have found that using the benzonatate alone does not reduce your cough symptoms, but if it's combined with guaifenesin or the Mucinex that you buy over the counter, if you combine benzonatate and guaifenesin, then there is a huge reduction in your cough symptoms if you have acute bronchitis. So that is a take home for you there. So when you see your doctor and they prescribe those medicines for you, there must be a combination of the two to reduce your symptoms. Then what about herbal preparation? Do herbal preparation work? Home medications, do they work? Because people tell you take honey, lemon, and all this kind of stuff. What is the evidence? There have been a lot of studies done on a lot of herbal preparation, and there are two of them that is very promising. The first one is called pelargonium, Pelargonium, which is it's a South African herbs that is there that have been using to treat cough. And there has been studies also done and reported that there is a modest reduction of symptoms people who have acute bronchitis. And there is another one, euthanasia. Euthanasia has mixed studies. Some studies prove that it reduces your symptoms of the cough. Some studies say that it's not. So there's a mixed studies on euthanasia. Then another study is on dark honey in children over a year old. Actually, as compared to the over-the-counter cough medication, dark honey given to your child actually gives your child good sleep and also reduces their cough symptoms, but the child has to be over 1 year old. Now, the use of antibiotics has not been proven to be effective at all in people who do not have certain conditions, because they either give you more side effects, and the people do not really benefit for using antibiotics for just viral bronchitis. Now, people who have special cases, like if you're exposed to somebody who has a whooping cough or pertussis, then bronchitis, when you treat that kind of bronchitis, should be given antibiotics actually to stop the spread of it, and also helps to reduce the symptoms of that kind of bronchitis caused by a whooping cough. And another one is people who have asthma or COPD, or people who have congestive heart failure who has had chronic bronchitis or acute bronchitis. Antibiotics has been indicated. Now, one of the things that doctors are doing these days is that there is a test called procalcitonin levels and C-reactive protein. There have been a lot of randomized control studies in the ER7 that if those numbers are high, if your procalcitonin level is high, or if your C-reactive protein is high when you have a bronchitis, then it's an indication that it's bacterial, and so you benefit from using antibiotics treatment. So that is the evidence that I have been found so far. Now, what about albuterol inhaler? Now, sometimes you go to the office and they give you albuterol inhaler. Again, if you don't have an obstruction in your airways, or if you don't have an asthma, or then albuterol really will not help you to reduce your symptoms of chronic bronchitis. What about steroids? Again, there's not really proven that oral steroids work, but inhaled steroids sometimes work for people when they're wheezing or they have obstruction. Then inhaled steroids might also help with acute bronchitis. So those are the things that will help you if you do suffer from acute bronchitis. So the take home is that use a combination of guaifenesin and benzonatate to reduce the duration of your cough. You can use pelargonium as a herbal treatment, euthanasia, or if you have wheezing in your lungs, then you have asthma, wheezing, then maybe a albuterol inhaler can help. But again, antibiotics will not help unless you have pertussis, or you have COPD, asthma, or you do have congestive heart failure. So these are some of the things that I wanted to take home today on acute bronchitis, the evidence-based medicine. So again, if this has been helpful to you, I want you to give me a like, subscribe to this channel, share this information with your friends so that they'll benefit from it, so that when you have bronchitis, they can treat it the right way. And also, if you have had an experience, share your testimony in the comment below for our viewers can also learn from it and benefit. Until then, I say stay well.